Lord Jesus Christ, you are the light of the world. Please enter our minds with your peace and into our hearts with your love. We ask this in your name. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen. Dr. Joe, please.
Wow. Thanks, Jerry. Good evening, everybody.
Good evening.
Good evening, everyone who is tuning in on either Facebook or on YouTube. Welcome to our presentation tonight. So my name is Joe Zalot. I'm a parishioner here at St. Simon and Jude Parish, and also one of the staff ethicists at the National Catholic Bioethics Center here in Philadelphia. So tonight, little quick outline of what we'd like to do. I'm thinking my talk will probably be somewhere between 45 minutes and an hour, and then question and answer. I'm willing to stay as long as you need to stay for question and answer. So for people who are watching online or for people who are here, keep the questions coming, except for you, John. So quick outline of what I'd like to do tonight. I'd like to start out really quickly, just giving a quick overview of the NCBC, the National Catholic Bioethics Center. We're kind of maybe one of the best kept secrets in the area, but hopefully maybe after tonight we won't be so much. Then I'd like to explain really what's at the core of the question about the ethics of COVID-19 vaccines. And it's what we call abortion-derived cell lines, or ADCLs, abortion-derived cell lines. Thirdly, we're going to explain Catholic teaching on vaccines that use these abortion-derived cell lines. What does the Church actually say about this? Talk a little bit about classification of COVID-19 vaccines, and then finish up by asking the big question, and that's what the slide says when we get to it, the big question. Can a Catholic in good conscience accept one of the COVID-19 vaccines that is presently available? And that's the big question that everybody is asking us at the NCBC, and I'm sure probably a lot of people have that question here as well too. And then wrap up with some resources that might be helpful to you. So real quick, just a quick overview of the NCBC. Who are we? Essentially, we are a think tank. We're a Catholic-based think tank, right? And we deal with issues of bioethics, life sciences, healthcare ethics. We cover a range of topics in the things we do. We're founded in 1972, the year before Roe v. Wade, and we're based right now in Philadelphia. The NCBC began in St. Louis, moved to Boston, and then moved to Philadelphia about 15 years ago. So we are located in Philadelphia. We have a staff of 18 people, and that includes 6 full-time ethicists and 2 part-time ethicists. And as our former president, John Haas, used to say, he doesn't know of any other Catholic healthcare organization or institution that has this many ethicists on staff. So we may be the biggest. I don't know. Also, very, very important, the NCBC, we strive to adhere to Catholic teaching 100%. So the presentation that you're going to get tonight is our understanding of what the Church teaches and our understanding of what the Church teaches. And that's where we are. That's our organization. It's part of our mission as well. So a couple of other things. What is the purpose of the NCBC? And this is in our mission statement, which you can look and see online if you wish. But our purpose overall is to promote and safeguard the dignity of the human person from conception to natural death, right? From womb to tomb, right? That's what we do. And very importantly, and I have this understood because I've said this every time I've done a presentation here, what do? We help people to understand and apply Church teachings. I've said this before, the Church as an institution, at least in my growing up, I was born in 1967, so I'm post-Vatican II. In my life, looking back in my childhood and growing up, I mean, the Church institutionally did a terrible job of educating me as to what it teaches and why it teaches what it does. So that's what the NCBC is seeking to do in terms of education, and that's why we're doing these presentations as well. Not only what the Church teaches, but why does it teach? And so tonight, what does the Church teach about vaccines developed, manufactured using abortion-derived cell lines? And why does it teach what it does? And how do we apply that to questions facing us literally today? right? Our primary activities, and I'll talk about this in a second in more detail, but consultation, education, and publication. That's really what we do. That's what our day is filled with. For those who are interested in getting in touch with us, our website, ncbcenter.org, our phone number is there. My contact information, and I'll put this up again at the end of the presentation, but, oops, right? I'm one of the staff ethicists, again, at the NCBC. That's my email address and my phone number. I do want to let people know, for those who are here, and I think everybody has them, I actually have notes. So all the presentation notes, you have them, plus some other resources. For those who are watching online, I believe Marty Harris, she said she was going to put a link to the electronic notes that I sent her. So if you have the electronic notes, there are web links for all of the various documents in those notes. And for anybody who's sitting here tonight, if you'd like the electronic notes with the web links, just email me, and I'll be happy to send them to you. But I'm not going to do it tonight, I'll do it tomorrow. All right? But that material is all there. Two other things really quickly. I'm not a medical doctor, I'm not a scientist, I'm not a researcher. All right? So tonight we're not going to get into the science and get into the nitty-gritty of all that. We're going to be talking about ethics, right? The ethical questions involved. And one last thing, and I just put this up there because I always get a laugh. I had one I was on consul duty yesterday. Sometimes people think I'm a priest. I'm not, all right? My wife will, I think she'll attest that I'm not a priest and I'm not capable of being a priest, so, whatever the case may be. But it's funny because people will say, oh, thank you, Father, and I'm like, no, I'm not a priest, but it's actually kind of funny. So again, please feel free, if you have questions, if we don't get questions answered tonight, please feel free to email, call. That's why we are there, right? So a couple things, and I just really want to mention quickly some of the main things that the NCBC does, because we provide services for all of you. Probably our most public service is our consultations. As I said, we've got an ethicist available 24/7, 365. All right, so when issues come up, if emergency issues come up, you can contact us. I've gotten that phone call, Sue will attest to this too, I've gotten that phone call at 1 o'clock, 2 o'clock in the morning when people are calling in asking for advice and things. We do individual consults and we do institutional consults. So our individual consults, we do give or take about $1,500 a year, but I think this year is actually going to be a lot more with COVID-19. So that number is probably going to go up. And they are free. We don't charge for those. And again, the contact information is there. People ask us all sorts of questions. A lot of COVID-19 questions right now, but also a lot of end-of-life questions. We get questions all the time about, my mother or my grandmother is in the ICU and they're talking about withdrawing care. Is it, can we do that or not? Right, so we deal with those questions quite a bit. Institutional consults, just mentioned really briefly, deal with a lot of mergers when Catholic hospitals merge with a non-Catholic hospital. We also have what we call our SEER program, our Catholic Identity and Ethics Review, where we actually go in and bishops invite us in to do reviews of hospitals and hospital systems. How are they maintaining their Catholic identity? How are they maintaining Catholic ethics? So we do a lot of that. In terms of education, number of things. Go back. So we've got our Bishops' Workshop. It's a biannual event where we invite bishops to come and essentially learn about what's going on, as I'm tripping over myself, what's going on in terms of the world of bioethics. Interestingly, outside of the U.S. bishops' semi-annual meeting, so they meet every November in Baltimore, they meet in June wherever around the country, aside from those meetings, this is the biggest gathering of U.S. bishops in the country, right? So we get U.S. bishops, we get Latin American bishops, Caribbean bishops too. Right? So we educate them. We have a workshop for them. We also have a certification program that's open to anybody. If you're interested, let me know. We also have seminars. We do them around the country. It's part of the certification program, but we do an introduction, kind of a crash course in Catholic bioethics. So those are available as well too. Oops. We also have a number of resources on our website. So if you go to ncbcenter.org, if you click on resources and then go to topics in Catholic bioethics, it pretty much is what it says. There's a whole bunch of different topics: end-of-life care, beginning of life care, gender identity issues, all of that stuff. What, the resources that we have. Lots of stuff available on the website. Under our blogs and podcasts on our website, we have our Bioethics On Air podcast. And I'm kind of partial to it because I host it, so that's why it's a shameless plug. I have a couple of examples of podcasts that we've done on COVID-19. We'll talk about those a bit at the end. But just if you're interested, we just recorded one, just posted one, I should say, with our president and our director of publications. The title of it was Catholic Healthcare in a Biden Administration. So talking about what are some of the challenges that are coming down the road with the change in administration. And also a public policy, under the public policy section of the website, our bioethics public policy report. It's an update, it's a bi-weekly update of things that are happening in the world that affect Catholic healthcare. And so if people are interested in that, just email me, I'll put you on the distribution list, and it's all good. All right, and last thing, our ethicists are available for interviews, presentations all over the place. And just I put a little note up there, we just found out the other day that EWTN, you guys ever heard of EWTN? EWTN has said that we are their go-to organization for ethical questions concerning COVID-19. So, yeah, we follow church teaching. I mean, if EWTN is looking to us, we can't be that bad. So that's what's going on there. Publications, just real quick, and then we'll get into the coronavirus stuff. We've got a lot of different things available to you. This is just a short list right here. So our Catholic Healthcare Ethics, the Manual for Practitioners, that's kind of our Bible, so to speak, or our encyclopedia of, where does the NCBC stand on a whole range of healthcare issues, from beginning of life to end of life, everything in between. So that's available on our website. We also have our academic journal, our National Catholic Bioethics Quarterly. We have Ethics and Medics, which is our monthly publication, which is more popular, for more of a popular audience. And then we have a number of books and guides and things that are on our store that are available on our website. And I just list a few of them here. So A Catholic Guide to End-of-Life Decision Making. That has been around for a while, and it's still very, very popular. It's also available in Spanish. A new one we just put out, Catholic Guide to Palliative Care and Hospice. Was here, I don't know how many months ago, did a presentation on palliative care and hospice. And this has come out in part from that presentation and other things as well. But that's available on our website too. And then we've got some things forthcoming, a Catholic Guide to POST, which is the Physician Orders for Life-Sustaining Treatment. That's an end-of-life document again. And a Catholic Guide to Assisted Reproductive Technology. So those are in the works. But again, so again, just a kind of a quick overview, just seeing what the NCBC does. And we're a resource, we're available. Please take advantage of us to the extent that you can. All right? All right, so let's get into the meat and potatoes of what's going on here. And my apologies, because you can't really see it. The projector's not very bright, but that's supposed to be the coronavirus. Yeah, a little dark.
Too many spotlights.
Yeah, well, what can you do? So anyway, so that's supposed to be the coronavirus vaccine. So our talk tonight is about the ethics of coronavirus vaccines. You've probably heard a lot of stuff on the news, on social media. I'm not on social media, so I don't get any of that. But there's a lot of good information out there. There's a lot of bad information out there. There's a lot of misinformation out there. We see, even in the Catholic Church, we see very differing positions coming out. We see Bishop Strickland down in Texas, Bishop Brennan out in California, Bishop Schneider, who's in Kazakhstan, holding one position. We see the USCCB, the U.S. Conference of Catholic Bishops, holding a very different position. And people are confused. They're calling us, and they're like, what's going on? Like, what do we do? Talking about consultations, I was on consultation duty for the past 2 days and had 20 some odd, 24, 25 consults. Still a couple more that I haven't done yet. I got to get to later on today. But most of them have to do with COVID-19 vaccines. People are they're trying to figure out what's going on here. All right, so hopefully tonight we'll start to, to answer some of those questions and give some clarity about what's happening. All right, so how do we start this discussion? Well, there's a number of ethical issues, a number of ethical challenges to talk about. But the big one, at least from our perspective, at least from the Catholic perspective, is how the vaccines are being developed, produced, and tested, right? And the key for all of this is the use of what we call abortion-derived cell lines, or ADCLs, right? Abortion-derived cell lines. So first question, what are abortion-derived cell lines, right? What the heck are we talking about? Anybody here, and I know the people who are maybe watching can't indicate this, but has anybody here ever heard of Henrietta Lacks? Ooh, usually some people have. My daughter Maria, who's running the computer over there, she's heard of Henrietta Lacks. All right? For those who may not have heard of her, Henrietta Lacks was an African-American woman. She died in 1951. I just looked that up today to make sure I had the right date. She died in 1951. She had cervical cancer. And she was at a hospital in Baltimore. We'll remain silent about which one it was. But what the hospital did was they took a biopsy of a tumor that she had, and unbeknownst to her, they took those cells and they were working with them, and they found that these cells from this tumor had this amazing capacity to replicate themselves. Replicate themselves again and again and again and again and again, so that the cells were quote unquote immortal, right? And these cell lines were really, really important because researchers use them for their research and any number of different things, including vaccines, all right? So not getting into the science or anything like that, but these cell lines are really, really important for pharmaceutical companies and all sorts of different research, right? So what does this have to do with what we're talking about here? Well, researchers, they're like, oh my goodness, look at these cell lines. This is amazing. They were using animals and different other things as well too, but they really wanted to use humans, because if you're making pharmaceuticals for humans, it's kind of best to use human cells. And they wanted the most pristine human cells, and they wanted the most versatile human cells. So where do we get those? And researchers kind of went, you know what would be a good source for these cells that we're looking for, these pristine and versatile cells? What about aborted children? Right? Very young, obviously. They're not, the cells aren't contaminated. I mean, I'm 53 years old, so my cells are very contaminated with all the viruses and things that have been, that I've been fighting off in my lifetime and everything else. But these cells are pristine, and they're young. They're very, very versatile. So what researchers started doing is saying, okay, all these abortions are happening. Let's get organs and tissues from these aborted children. Sort of like what Planned Parenthood, for those of you who are, David Daleiden and their undercover videos showing Planned Parenthood selling body parts of aborted children. Well, that's what researchers were doing, right? So what they would do is they would get the organs and tissues from aborted children, and they would take the organs, and they would cut them up, dissect them up, and they would try to get the cells to replicate. Oftentimes it didn't work, sometimes it did, right? And so what they developed were cell lines, like the Henrietta Lacks cell line, but they developed cell lines that were derived from aborted children. And that's where we get abortion-derived cell lines. And some of the more famous examples are these here. So WI-38, Wistar Institute 38, the very first, as far as I know, the first abortion-derived cell line, 1962, was actually created, quote unquote, right here in Philadelphia, right, at the University of Pennsylvania, the Wistar Institute, a researcher named Leonard Hayflick, right? He was the first one to do this, and he developed this WI-38. It was the 38th trial, right? And that one worked. And the cells just divided, trillions and trillions and trillions of cells. and then they would take these cell cultures, sell them to pharmaceuticals and whatnot else. Right? WI38 cells are still used to this day. Not as much as some others, but they are still used. So then there's the MRC5. Oh, by the way, the WI38 cells were taken from a, I don't know what gestational age, but it was a girl in Stockholm, Sweden. So she was aborted, and then her lungs were flown to Philadelphia to Hayflick, and that's where the cell line derived from. MRC5 was developed in 1966. HEK293, that's a human embryonic kidney from the Netherlands, from a child who was aborted in the Netherlands in 1972. The HEK293 cell line, that's the one that's at the center, or the ethical center of the 3 vaccines, the Pfizer, Moderna, and AstraZeneca. And we'll talk more about that in a bit. But HEK293, that's the cell line in question right now, right? Relevance for today. An abortion that happened in 1972, right? These cell lines are being used to this day, and they're at the center of the controversy. Percy 6 in 1995. Walvax 2, that was developed in China in 2015, right? Now, you see up here I've got in red Biden administration with a question mark. So I just kind of a bit of an aside. So been an interesting discussion, we won't go through it, but there's been an interesting discussion over the past 20 some odd years plus, about federal funding of research that creates these cell lines, right? That destroys embryos, creates these cell lines using aborted fetal tissue. So in 2001, President George Bush, the second George Bush, essentially put an end to federal funding for research that would create embryos, destroy embryos, or be available for these cell lines, right? When Barack Obama became president, he reinstated funding. When Donald Trump became president, he ended funding. With the Biden administration, everybody's pretty much guessing that funding is going to be restored. So it's very likely that starting in January, our tax dollars once again will be going to fund research that uses these cell lines, and hopefully doesn't create more, but who knows what's going on. Just want to mention something very quickly, because this is something that gets confused, particularly with the COVID-19 vaccines. Abortion-derived cell lines are not embryonic stem cells. We hear people making they're confusing those quite often. They'll say we're hearing that these COVID-19 vaccines are using embryonic stem cells. That's not the case, right? Stem cells are cells that are taken from a human embryo, right? The stem cells are non-differentiated cells. We could talk about that later if you want. But they are taken from a human embryo, and that causes the embryo's death. That's why the Catholic Church is very much against embryonic stem cell research. Abortion-derived cell lines are very different. Now, certainly, an abortion's happened. That's great evil, right? But the abortion has happened, and these are cells that are derived from the organs and tissue, right? So it's a different thing, right? So if you see people talking about stem cells, there are no stem cells in COVID-19 vaccines, right? It's the abortion-derived cell lines, right? One last thing on here. Let me get that to work. People say, oh my goodness, this is terrible that these abortion-derived cell lines are being used in COVID-19 vaccines. Yes, it is, but the fact of the matter is these cell lines are being used in many of the pediatric and other vaccines that children are receiving all the time. Maria, can we change over? And this is one of your handouts. It's a, go the other way. Yep. All right, so you have a slightly different version for people who are here. But if you have the link at home and you open this up, you'll get this version here. So this is actually a chart that's put out by an organization called Sound Choice Pharmaceutical, very pro-life. And what it does, over here on the left-hand side, and I don't know if you can see, it's blue over here, it lists the disease. Here in the red, you see the product name, manufacturer, the fetal cell line. These, if it's in red, this is an abortion-derived cell line that the vaccine is using. If it's in green, it's a perfectly ethical cell line that's being used to the vaccine. So I'd just like to point out a couple things. Please note, chickenpox, and for those who are here, you can see this a lot better. Chickenpox, right, the vaccines that are out there now, made by Merck and GlaxoSmithKline, that's what GSK is, and they use the WI38 and the MRC5, right? Is there an ethical alternative? This is the participatory part. No, right? There's no ethical alternative. So if you get a chickenpox, if you or your child get a chickenpox vaccine, you're accepting a vaccine that's developed and manufactured using abortion-derived cell lines. Maria, can you go down to where we were before? Go to measles, mumps. Yeah, measles, mumps, rubella. Yep. The measles, mumps, rubella vaccine, right? If you're getting that, Merck, GlaxoSmithKline, again, you see WI38, you see MRC5, right? That's the vaccine that most people are receiving. There is an ethical alternative, but it's only available where? Japan. In Japan. So you could go to Japan to get it if you want, right? There have been efforts to try to get that vaccine here in the U.S., make it available in the U.S., but those efforts have not been successful. So if you're getting the measles, mumps, rubella vaccine, you're accepting a vaccine that is developed and manufactured. The ongoing manufacturing process uses these abortion-derived cell lines. Some good news, though. There is some good news about all of this. I'd like to mention polio. I was like, oh my goodness, polio? It's like, I thought we eradicated polio. Well, up until just a little while ago, actually probably about 6 months ago, the Sanofi Pasteur, right, a big pharmaceutical company, they had been using, their poliovac vaccine had been using MRC5 cell lines, right? That's an abortion-derived cell line. They changed about 6 months ago. In fact, they announced, they said, we're no longer going to be using MRC5, we're going to be using Virocell, which I believe is from monkeys. It's a monkey cell of some part. So Sanofi Pasteur just recently, they said, we're, at least in terms of polio, you'll see them up here in other places as well too, but their polio vaccine is no longer using these cell lines. Another good one, and I know most of us probably aren't so much worried about polio because we got that when we were a lot younger, but down here on the bottom, Maria, can you bring that up a little bit if it comes up at all? So shingles, oh, there you go, thank you. So shingles, right? I'm 53 years old, so I had my shingles shot, and I'm sure probably other people have as well too. Up until about 3 years ago, 2-3 years ago, the only choice was a vaccine from Merck called Zostavax. And that used either the WI38 and probably both WI38 and the MRC5 abortion-derived cell lines. However, GlaxoSmithKline, about 3 years ago, they came out with a new vaccine called Shingrix. And they use cells from a hamster. I believe it was a hamster from China, so a Chinese hamster. Whatever. But perfectly ethical, right? And in fact, the Shingrix vaccine is, this is a technical medical term, it's kicking butt over the Zostavax. So the Shingrix is much more effective, and GlaxoSmithKline is they're kicking butt, they're cleaning up with it. And it's an ethical vaccine, and it's a good thing. And I remember I went to my doctor a couple years ago, and he suggested getting the vaccine, the shingles vaccine. And he said, we got this brand new vaccine called Shingrix. And I go, oh yeah, that's the ethical one. And he's like, what? And I said, yeah, the old one, Zostavax, used abortion-derived cell lines. He's like, you're kidding me. And I was like, no. And he goes, what? I didn't know that. I'm 100% pro-life. I had no idea. And I said, yeah, right? So there's a lot of education to go around. Now at this point, Maria, can you go back to, thank you. So at this point, you're probably going, okay, Joe, why are we talking about, let's get this up. This is one of the problems when we come back. We have to go back to the screen. You're probably saying, Joe, who cares, right? The issues with, the ethical issues here with abortion-derived cell lines, with pediatric and other vaccines, this is exactly the issue. It's what's going on with the COVID-19 vaccines. Exactly. It's the exact same thing, right? So what has the church taught about this? Now, this, as you're going to see, our first thing goes back to 2005. Right? So for a long time, nobody really knew that these vaccines, these pediatric vaccines and other vaccines, were being developed or manufactured using these aborted cell lines. This really only came to light late 90s, early 2000s. People didn't know it. In fact, interesting story. We have time for an interesting story? Yeah. So the WI-38 cell line was developed by Leonard Hayflick here in Philadelphia. And he used it, I think, I may not have this correct, but I believe he used it to develop a rubella vaccine, German measles, rubella. And so he developed it, and they wanted to test it, sort of like they're testing COVID-19 vaccines now. And one of the places that he asked to test was at a girls' school, or not a girls' school, but like a girls' home run by the Archdiocese of Cincinnati. Philadelphia. I used to live in Cincinnati. Run by the Archdiocese of Philadelphia. And in fact, Cardinal Kroll at the time was 100% behind this. 100%. But he had no clue that the vaccine was developed using an abortion-derived cell line, using this WI-38 cell line. So it's one of those little ironic things that went on. So all of this starts to come to light in the early 2000s. And in fact, this document actually came about because of a letter that a woman named Debbie Vinage, who's a friend of the center, I've met her, she's a great person, she actually wrote to the Vatican. She wrote a letter to, she wrote it to then Cardinal Ratzinger, who was the head of the Congregation for the Doctrine of the Faith under John Paul II. She actually wrote him a letter and said, what are we doing about this? Right? And so the Pontifical Academy for Life in 2005 put out a statement. Now, again, this is not about COVID-19 vaccines, because we didn't have COVID-19 then, but this is about the pediatric and the pediatric and other vaccines. And this has great relevance for us today. So it's a big, long document, but basically what it comes down to is this. Question, is it permissible, right? Is it permissible for parents, usually, to accept vaccines that were developed and manufactured using these abortion-derived cell lines? That's what it comes down to. Can we use them? It's like, oh my God, because everybody's getting them already, right? Can we use them? And the answer that came back from the Pontifical Academy for Life, they said, yes, it is permissible to use them, as long as there's no other alternative, as long as there's no ethical alternative, which for many, we just saw, for many of these vaccines, there wasn't. Assuming there's no other available option, it is permissible because two things, basically. One is, it's a very serious health risk, all right? Rubella, big, huge risk, particularly to unborn children if a woman gets rubella. Polio, enough said. All right? Because they protect against a very serious health risk. They offer a great good to society. And secondly, the recipients, right? So the person who receives the vaccine or the parent who consents to their child receiving the vaccine, their cooperation in that original abortion that took place in the 1960s, 1970s is very, very, very remote, right? If you want to get into technical terms about the principle of cooperation, it's remote, immediate, material cooperation. We don't need to get into all of that. But it's very, very remote. It's very far away from the act of the abortion, right? So this is what the church said. Now start to think, how does this apply to COVID-19 vaccines? Because it does, right? So kind of keep all of this in mind. There's a method to the madness here, right? So yes, assuming no other options, because it provides a great good, and your cooperation is only very remote. In 2008, the Congregation for the Doctrine of the Faith, in its document Dignitas Personae, kind of expanded upon this. And again, I'm just giving very little snippets of this. These documents are much bigger than this. But essentially, and this is a quote from the document, they say, danger to the health of children could permit parents to use a vaccine which was developed using cell lines of illicit origin. They're talking about abortion-derived cell lines here, right? So they're restating, they're affirming what the Pontifical Academy for Life said back in 2005. while keeping in mind that everyone has a duty to make known their disagreement and to ask that their healthcare system make other types of vaccines available. So what the church is asking us to do is, if you accept one of these vaccines, right, that use abortion-derived cell lines, you can do it in good conscience. However, what it also asks you to do is to voice your disagreement. And one of the ways you can do this is, now it's not working, it's coming up, there we go, is with an organization called Children of God for Life. This is Debbie Vintage, the person I mentioned before who wrote the letter. This is her organization. Maria, can you go over to that? Just to her webpage. It's there in the middle. So this is her webpage. And up here it says Take Action. Maria, can you click on Take Action? And then go down to the bottom. You probably can't see it, but it says Voice Your Complaints. And what Debbie actually does on her website is she gives, she gives names and addresses of companies, GlaxoSmithKline, Sanofi Pasteur, and others. She gives you names and addresses for people to write to contact, to voice their disagreement or their displeasure. All right, so that resource is available as well too for you. Thank you. Let me get some water here while Maria's doing that. All right, so that's from Dignitas Personae. In 2017, I just bring this one up as well too, the Pontifical Academy for Life again put out a statement. It's a much shorter statement. It's only about a page, maybe 2 pages long. And they were addressing an issue that was going on in Italy. So in Italy, sort of like here in the US, there was kind of an anti-vaxxer movement, or there is an anti-vaxxer movement, where people are just, for whatever reason, they're not vaccinating their children, and you're getting these outbreaks of measles and mumps and all these various things. The same thing was happening in Italy. And I just give one little snippet of that statement too, because again, it has relevance for us today. In the context of the shared commitment to ensure that every vaccine is free of any connection to biological material derived from abortion in terms of its preparation. All right, so again, they're recognizing the problem here. They're recognizing the problem. We reiterate that the moral responsibility of vaccination in order to avoid serious health risk for children and the general population. So that what they're telling parents is, yes, there is this problem, but there is a moral responsibility that you have as well to look out for the greater good of society. All right? So you can see sort of a balance going on there. I do want to notice it says responsibility. It doesn't say obligation. All right? So we have a responsibility, to do what we reasonably can to assure the health of all. All right? So with this background, now let's kind of bring it forward to today. So what does all of this mean for us today? So let's look at the three, actually four, COVID-19 vaccines and apply kind of what we've learned so far, right? So we at the NCBC, among others, we classify COVID-19 vaccines into 3 categories. Category 1, right, or group 1, I should say, are vaccines for which no abortion-derived cell lines were used in development, in manufacture, in testing, anywhere. Right? None at all. How many of those are available right now? None. Unfortunately, none. There are some that are in development. They haven't reached the trial stage yet, but hopefully they will become available at some point. All right, but right now there's none. Group 2, all right? Group 2 are vaccines for which abortion-derived cell lines are not used in the manufacturing process. All right, so you've seen these things on TV where Moderna, Pfizer, they're churning out, you've seen them packed in the boxes and being put on planes and everything else. The production process is not using any of these abortion-derived cell lines. However, the HEK293 line, the one that we identified before, the human embryonic kidney, 293 cell line. That cell line was used at some points in the development process. Now I have development underlined and quoted because there's all sorts of confusion and all sorts of confusion about that term because people use it differently. There's development in the broad sense and development in the narrow sense. What are we talking about here? The two vaccines that are in this category are Moderna and Pfizer. So as you all know, Pfizer was approved by the FDA last week. Moderna, an advisory committee actually just approved, well, they're going to recommend full approval. That just happened today, as we speak. Today, that happened. Right? So Moderna got through the first round, and I'm sure by this time tomorrow, the FDA will approve the Moderna the Moderna vaccine, and that will be available very, very, very soon. Right? So these are the two that are in this category. Now, development, what does this mean? Right? So there are some who will use development very narrowly. And they will say that Moderna and Pfizer, no cell lines were used in the actual development, their work in the development of the vaccine. Now that may be true. However, and again, don't ask the technical stuff because we're still all trying to figure it out. Apparently what happened was in the confirmatory test stage, these cell lines were used. So what does this mean? Someone explained it to me this way. Imagine you have an assembly line, right? We're building a product and we have an assembly line. And there's 100 steps in the assembly line, right? And step 10, in order to confirm that what we're doing at step 10 is the right thing, that we're going to get the effect that we want, either we do or we contract out or we get information from somebody else, some confirmatory test that tells us that step 10 is going to work the way we want to do it. And that confirmatory test used abortion-derived cell lines. Does that make sense? Does that make sense? So is it part of the development narrowly construed? No. But are these confirmatory tests part of development widely construed? And the answer is yes. So this is part of the confusion and part of the problem. It's like, well, how do you understand development? Right? Some people are going to understand it narrowly, some people are going to understand it widely. Right? But in confirmatory testing, both the Moderna and the Pfizer vaccines made use of, quote unquote, either directly or indirectly, these HEK293 cell lines. So are vaccines in group 2, are they completely ethically free? It's not the right word, but you know what I mean. There's an ethical taint to them, right? Then you have group 3. Grape 3. Group 3 are vaccines that use abortion-derived cell lines in the manufacturing, in the development, and assumably in the testing as well too. And those include AstraZeneca, which has been the AstraZeneca vaccine, which has been approved in the United Kingdom. And in the United States, Johnson & Johnson, through their subsidiary Janssen. So you'll either see it Janssen or you'll see it Johnson & Johnson. Excuse me. Those two vaccines have abortion-derived cell lines through the entire process. Right? Again, AstraZeneca is available in England right now. It's been approved in England. It will probably be approved in the US. And Johnson & Johnson is on the way. It will probably, I'm guessing, probably within the next month or so, it will be approved. Right? So these are the three groupings. And the Moderna, Pfizer, and AstraZeneca, those are the ones that are essentially available now. I'd like to point you to a great resource. We at the NCBC, we're not, well, actually one of our ethicists is a neuroscientist, so actually we draw upon him. But I'm not, right? I'm not a scientist, I'm not a medical doctor, I'm not a researcher, I can't talk about the ins and outs of all of this stuff. So we rely on the information from an institute called the Charlotte Lozier Institute. Very pro-life, great organization. Lozier Institute is their website. And they have a resource up on their website, Maria, if you would, It does a great job. It has a chart, which we'll get to in a second. There it is. Oh, actually, Maria, go to the, so this is they have this up on their website. This is their update. It's called COVID-19 Vaccine Candidates and Abortion-Derived Cell Lines. So originally it came out in September. And by the way, the author of it is a Dr. David Prentice. Very pro-life, excellent researcher. He absolutely wants to get rid of all of these abortion-derived cell lines. Great resource. I've gotten emails and stuff from him, just fantastic. Excellent resource for all of this. But he wrote this originally on September 30th, and as you can see, it was updated December 14th. So this is very much up to date. Maria, if you go down and stop right there. So what you'll see is that there's a chart here, and you'll see so the sponsor, the name of the virus, and there's going to be a lot of them. We're not going to talk about all of them, but I just want to point out a few of them. What country they're in, the strategy, that gets technical. We won't talk about that. Where is it in its clinical trials? Is it getting public funding? And then over here, this is the important part, the design and development, production, and confirmatory tests. And what they've done is, if there's no abortion-derived cell lines, it gets a green square. If it does use abortion-derived cell lines, there's the red triangle. If there's some do, some don't, you'll see both, or kind of a half and half in there. And then if we don't know, that's a little question mark right there. You probably can't see it. So what they've done is they've put together this chart, this resource that's incredibly, incredibly helpful. And for people here, you don't have that in your notes. I didn't give that to you because it's about 10 pages long. But it's in the electronic notes for people who are watching. You can click on it, and it'll go right to this, right to this source. Maria, if you would, just slowly, let's kind of move our way up. So first you'll see whole virus vaccines, and you'll see a number of them from China. Go up a little bit more. I want to just stop at the John Paul, no, up, sorry, down. The other up. Stop, oh, go back. All right, so John Paul II Medical Research Institute. This is an organization, they're based in Iowa. And they are absolutely, well, John Paul II Medical Research Institute, that should tell you right there. Absolutely 100% pro-life. They are looking to, one of their things they're doing is looking to develop a cell line, an abortion, not an abortion-derived cell line, but an ethically produced cell line that is as good as, if not better, than those abortion-derived cell lines. So they're working. Unfortunately, their vaccine is preclinical, which means it's not even clinical trials yet. So that's a long way off. Maria, if you would, keep going slowly. Get into viral vector, keep going, and stop. So here you see AstraZeneca. All right, we talked about this one. AstraZeneca, being developed in the UK. It's got UK and US, but it's pretty much been developed in the UK. It's completed phase 3 trials. So there's phase 1, phase 2, phase 3. Phase 3 is the last one. Right, so they've completed phase 3 trials. It's actually gotten Operation Warp Speed money to the, looks like about $1.2 billion. So that's our tax dollars going to do that. But as you can see, in the development, in the production, and in the testing, you see red triangles. And what do you see? I don't know if you can see that. Can you see that? What cell line that is? It's the HEK293 cell line. That's what's being used. Right? So Charlotte Lozier is telling us, right, this is unethically problematic. Ray, if you would, down. Keep going. You can see there's a whole bunch of different ones. And up, stop. Oh, excellent. Stop right there. Perfect. All right. Janssen, right? So this is the Johnson & Johnson vaccine. Again, US, they're in phase 3 trials right now. Operation Warp Speed looks like they have gotten $1.4 billion of our tax money. But again, red triangle, and they're using the PER-C6 abortion-derived cell line, right? So that's there. Okay, go down again, Maria. Keep going. We're gonna find protein-based. Keep going. We need to get to the MR. Oh, here it is. So the RNA vaccines. This is the messenger RNA vaccines. And if you go down, we should find Moderna, and there's Moderna. and there's Pfizer right below it. So we have Moderna, right? Again, the description of it. This actually needs to be Pfizer needs to be updated because it says FDA emergency use authorization requested. That's actually been granted. This will change to granted tomorrow. Operation Warp Speed, this one, Moderna has received about $2.4 billion of our taxpayer dollars. Green on development, green on manufacture, green and red on confirmatory tests. Some of the confirmatory tests were used ethically, ethical cell lines. Others did not. But notice once again, which cell line? HEK 293, once again. And then below it, Maria, can you just go down so we get Pfizer up? Yep, thank you. All right, Pfizer, BioNTech, same thing. Emergency use has been granted already. It was granted last week. People are getting the Pfizer vaccine right now. Once again, Operation Warp Speed, $1.95 billion for Pfizer. And again, design, production, confirmatory testing. All right, there's some questions, well, not questions, but they use the HEK 293. All right, so this is a wonderful resource, and Charlotte Lozier is updating it regularly, and you can kind of watch and see what's going on. Okay, can we go back to the thing? And so we're back, and I just kind of have the same. There it is. I just kind of have the same thing. This is exactly what we just looked at. So AstraZeneca, Moderna, Pfizer. AstraZeneca, HEK 293, not good. Pfizer and Moderna, or Moderna and Pfizer. Again, some of the confirmatory tests used HEK 293. All right? Yes, no? Yeah. All right. We're coming to the end. I told you the big question is here. All right? Dun, dun, dun. This is like Jeopardy. All right? So here's the big question. All right? Here's the big question. And this is the question that people are asking us again and again and again and again and again. All right? Can a Catholic in good conscience accept one of the COVID-19 vaccines that use an abortion-derived cell line in its development and or production and or testing? Is it permissible? I forgot to put testing up there, my bad. Is it permissible to do that? Right? Is it permissible to take this vaccine? And again, you see a whole bunch of stuff. You see, again, Bishop Strickland, Bishop Brennan, Bishop Schneider on one side, USCCB on the other side, sort of, kind of, on the other side. All right? What's the answer? From our perspective, from the NCBC's perspective, we're trying to hold the middle, kind of like Aquinas, the virtuous mean. Right? That's what we're trying to be. So can a Catholic accept a COVID-19 vaccine? Whoop. Yes, right? Yes, right? One can accept a COVID-19 if two conditions are there. One, there's a proportionately serious reason to accept the vaccine. Now, certainly COVID-19 it's a very dangerous disease. Nobody's going to deny that, right? But what we believe, what the church is asking us to do is to look at our particular life circumstances, right? What are we doing? And I'll give you an example from a conversation that I had with a physician a couple weeks ago. In fact, I got to give him a shout out in case he's listening, but I don't know if he is. Tom McGovern. He's a great podcast. If any medical professionals here, it's the Catholic Medical Association has a podcast called Dr. Doctor, and Tom is he hosts it. Great guy. And we were having an email conversation a couple weeks ago, and he asked me this very question. He's like, "Oh my goodness, can I take this as a doctor?" And I said, well, let's look at your life circumstances, right? He's a surgeon, right? So he is up close and personal, literally and figuratively, with his patients, right? And in his specialty, he's dealing with patients who are of, let's just say, greater maturity. We'll just say that. And we do know that COVID-19, it doesn't strike, I should say. The complications are much greater for people as, with age, right? And so from his perspective, it makes sense. Yes, I mean, He doesn't want to pass, he doesn't want to get it himself. He doesn't want to pass it on to his patients. Right? So his circumstances are such. Me, other than this, I'm working either from home or in my office, and most of our people are working from home, so I'm like socially distanced even if I didn't want to be. You know, it's kind of like, so my life circumstance is a little bit different from his. Right? So what we're called to do is say, okay, what are your life circumstances? What's going on? Are you a healthcare professional? Right? All the healthcare professionals are getting the vaccine now. Are you elderly, particularly those who live in assisted living facilities? Right? We know that COVID-19 hits these populations very, very hard. Right? So what are your life circumstances? And also, there's no, and this is my term, there's no less ethically tainted alternative available. Right now there isn't. Right? The best, quote unquote, ethical alternatives we have are Moderna and Pfizer. Right? But they're not completely clean, ethically. Right? But that's all we have. We have no other option. Right? Just like, you know, the Pontifical Academy for Life, Dignitatis Personae, we saw that a little bit earlier. Right? Proportionately serious reason, no other alternative. If that's your situation, can you accept a COVID-19 in good conscience? And we say, yes, you can. You can accept that. We do ask that, you know, you should accept a vaccine from group 1, and before, no ethical taint at all, but unfortunately, again, there's no option for that right now. If there's no option from group 1, we would say choose one from group 2, either the Moderna or the Pfizer. But if you're in a situation where group 1 or group 2 are not available, it's not working, there we go, you could choose one from group 3, so AstraZeneca or Johnson & Johnson if and when it comes out, right? But, you know, that's one side of what we're recommending. But then the question also becomes, can I refuse a COVID-19? Right? Can I in good conscience refuse a COVID-19? And the answer to that question is yes. Right? Yes, one can. Right? Remember back with the Pontifical Academy for Life's 2017 statement, and I had the word responsibility in italics. There's a reason for that. Right? It was responsibility, it's not obligation. Right? We don't have an absolute moral obligation to vaccinate. It's probably a pretty good thing, particularly with pediatric vaccines and everything else. It's highly prudential to do, but you can't claim that there's a moral obligation to do it. That's our position. So, could you refuse could you refuse a COVID-19 vaccine? Yes, right? You could. And there are some people who are refusing it because of the connection with abortion-derived cell lines. Although the church has said it is permissible to use them, there are people in their rightly formed conscience who say, you know what, I don't want any connection with an abortion-derived cell line. And I have a lot of respect and I have a lot of compassion for that position. Right? Their conscience is telling them, we can't accept this, and that's okay. There are others, and I want to be very cautious with this one. You keep your mouth shut, John. The reality is that the COVID-19 vaccines that we have right now, the Moderna, the Pfizer, the AstraZeneca, they're still in a lot of ways experimental. What do we mean? Well, the Pfizer and the Moderna are, well, Moderna not yet, but it will. It's receiving the emergency use authorization, the EUA. You may have heard of that. Well, the EUA, if you read about that, what that is, it's very clear. It's like, well, we don't have all the data, right? There's still a whole lot of data that we need to get to figure out effectiveness, and all of these different things, all right? We're allowing the use of it, but there's still a lot of work left to do. I mean, by definition, they are still, quote unquote, experimental, right? There are people who are concerned that the messenger RNA technology, I'm not going to go into the mechanics of that, but the Pfizer, excuse me, the Pfizer and the Moderna vaccines are brand new technologies. Brand new. And people are kind of skittish about it. It's like, okay, you go get it first. I don't want it. You know, it's kind of, that sort of thing. There are people who are, worried about the effectiveness of it. You'll hear on TV and whatnot, they'll say that the Pfizer and the Moderna vaccines are 95%, the efficacy rate is 95%. Well, that's in the trials, right? And they have sort of closed loop trials where things are controlled and everything else. What we really need to see is how do they work in the real world, right? And we don't know those answers yet, right? And we're not going to know those answers until people are vaccinated, right? People are also concerned with safety. Are there unintended effects that could happen? It's possible, but when I say that, please exercise a whole lot of caution. There's a lot of good information out there. There's a lot of bad information out there, all right? And we're hearing all of it, right? And there are some safety concerns, but there are some things that are just not true. And so again, just ask you to be very, very cautious when you hear people talking about safety concerns. But they are still out there. Now, if you do refuse a vaccine, we would say that that's okay, but you also have a moral duty to do everything you can to assure that you're not spreading COVID-19 to other people. So what would that mean? That would mean wearing a mask, which I'm not doing right now, but I'm keeping distant except from John, but he's got a mask on, so that's okay. Maintain physical distance. It may mean self-isolating yourself. It could, right? And there's also trade-offs too. You may not be able to visit people. You may not be able to travel. You may not be able to enroll your children in school. We get that question from just with the pediatric vaccines, even in Catholic schools, right? So there are trade-offs, right? So with the NCBC, what we're trying to do is hold a middle ground. Can you take a COVID-19 right now in good conscience? Yes. Can you also not take one for reasons of conscience or other? The answer is yes, right? Yes, you can, right? What we in the church are asking you to do is exercise your conscience, rightly formed conscience, right? Not knee-jerk reaction conscience, but rightly formed conscience, and understand what's going on, understand what the reality is, and make an informed choice based on your life circumstances, right? So that's kind of where we are. A couple of resources real quick. The USCCB just put out a document. It's caused a little bit of a stir. Some people aren't happy with it. Some people are very happy with it. But they put out a document, Moral Considerations Regarding the New COVID-19 Vaccine. That was December 14th. That was this past Monday. Today's the 17th, right? Yeah. So that was last Monday. We at the NCBC put out a statement last week on the Feast of the Immaculate Conception. Actually, it was posted on our website on December 7th, but our president said, well, we don't want Pearl Harbor Day, we want Immaculate Conception Day, so we're dating it December 8th. But points to consider on the use of COVID-19 vaccines. And essentially tonight, what I've given you is a summary of that document, right? So you don't have to read it, but no, please do. Also, again, some shameless plugs for our Bioethics on Air podcast. We've got a lot of COVID-19 actually resources on our website. Please come and look and see what we've got. But two of them I'd like to point out in particular. Bioethics on Air, our podcast 42 and 43. We actually recorded these it was late summer, I believe, that we recorded them. But they're still very apropos for what's going on right now. So the first one is Moderna's COVID-19 vaccine, is it ethical? And that was recorded, we recorded it with Father Tad Paholchik, who's one of our staff members. He's a neuroscientist, so he's very well in tune with all of this. And he was on with a guy named John Grabenstein, who, faithful Catholic, used to be the head of Merck Pharmaceuticals' global vaccine program. So John's got a wealth of knowledge, and in fact, we had John on a follow-up one a little bit later, a couple months later. And I'm still talking to John. Whenever I have questions, I call him up. I'm like, John, explain this to me. He's like, all right, I don't know. And he does. And then we followed that one up with a discussion with our president, Joseph Meany, and one of our staff ethicists, our fellow staff ethicist, John DiCamillo. And they did for the first 15 minutes of that, they did a review of the prior podcast, and it's excellent. It's really, really good, just talking about some of the ethical issues and ways to approach this. So I would encourage you, if you're looking for information, these two podcasts are very, very good. Little wrap up real quick again. Come back. Again, I'll just leave this up there for people at home. If you'd like to get a hold of me, if you've got comments or questions or concerns or anything, that's my email address. Hopefully you can see it, jzaylott@ncbcenter.org, and my phone number. It's my direct office number. Second thing, I think Father Gerlach he came in after giving absolution to many people at the penance service tonight, I hope. Father Gerlach and Jerry, our deacon, they well know this didn't cost the parish anything. They're not paying me anything. Well, I guess the electricity maybe, but whatever. But if people here or people at home, if you found this presentation to be helpful, we would appreciate. It's a free will donation. If you think this presentation was worth $1, please feel free to give us $1. If you think it was worth $1 million, one of these days somebody's going to do that. I don't know when, but no, seriously. We are the NCBC, we are a non-for-profit. We are very dependent upon our members and our donors and our education programs and things like that. So if you'd like to, if you thought this was helpful, please feel free to say thank you. We'll just leave it at that. And with that in mind, questions, comments, concerns? Anybody here? Or I know there was, Marty just left. I guess it was away. There's no, oh, we're done with that. Okay. So questions. I see John and I see Father Gerlach.
Only a comment. Brilliant. Thank you very much.
Thank you, John. John, just for those, Joe, are we still online? He's looking at his thing. Are we still online? Are we still broadcasting? Okay. John just said thank you for the presentation. So John, thank you for saying thank you. Appreciate it. Father Gerlach, nice and loud, and I'll restate the question for people who are watching at home too.
Issues of liability for the various pharmaceuticals. Rumor has it that none of the pharmaceuticals are financially or legally liable for either difficulties, mistakes, or the catastrophic.
Question that Father Gerlach asked had to do with liability for pharmaceutical companies, that they're not liable for adverse effects and things that would happen. You're asking the legal question. I'm not a lawyer. I know that there were laws that were passed that do shield the vaccine manufacturers from those things, but as far as exactly what's going on, I don't know enough to speak about it, so I'm not going to. Anybody else in terms of questions? John?
There is one from
Or
home.
Joe, sorry.
There is one from home.
A question from home, excellent.
It's a long one. Charlotte Lazier separates production, development, and testing. Using your assembly analogy, would a vaccine that uses ADCLs for development be like a conveyor belt? It doesn't end up in the product, but you cannot make the product without it. Pfizer and Moderna use ADCL for confirmatory testing only. So might that figure into choosing a vaccine, weighing that against it being a brand new technology?
I'm not sure I'm not sure I'm getting what the question is. Can you repeat that, Joe? And can people hear you, or do I have to repeat that too?
I think you'll have to probably repeat this, but okay, I said Charlotte Lazier separates production, development, and testing. Using your assembly analogy, would a vaccine that uses ADCLs for development be like a conveyor belt? It doesn't end up in the product.
So all right, let's just stop. Let's handle that one first. So the question, as I understand it, is using the image of the assembly line. If you've got a conveyor belt, are the abortion-derived cell lines, because it's a confirmatory test, are the cell lines not ending up in the final product? If that's the question, the answer to that is yes. There are no cells, so to speak, in the final product. And the second part of that was?
Pfizer and Moderna use ADCL for confirmatory testing only, so might that figure into choosing a vaccine, weighing that against it being a brand new technology?
Well, so the question is, Pfizer and Moderna use abortion-derived cell lines in the confirmatory testing, so does that play into the moral question? It plays into the moral question in the sense that those two, if I'm understanding the question correctly, those two vaccines, because they only use them for confirmatory testing, they are less ethically tainted than is the AstraZeneca or the Johnson & Johnson, which use the abortion-derived cell lines through the entire process, including the manufacturing. So would that, does that play into the question of whether it's ethical or more ethical to use Pfizer or Moderna versus AstraZeneca? I would say yes. Again, I think that's the question. I may not have that right. Anything else? Any others? Any others? Oh my goodness.
Dr. Joe.
Just Joe. No doctor, just Joe.
Looking at the vaccines that we're accustomed to from the past.
Can you put those back up? Yep.
As far as the amount of time that it took for COVID-19 vaccines to come, can you compare and contrast that? Was the COVID-19, like again, such a fast one as compared to the other ones that took, I don't know, years? Or
Yeah. So the question is, for those who may not have heard it, that Sister Barbara Jude is asking is, you talk about the time of development between these, the pediatric and other vaccines versus the COVID-19 vaccines. Yeah, that's another, the time frame is another issue that people bring up. So these vaccines here, and again, they're different vaccines, different timetables and everything else, but generally speaking, what I've heard from those who are in the industry or formerly in the industry is that for a vaccine to go from, conception, well, not conception, you know what I mean, from an idea to actually being commercially available is about 10 years. So it's it's a long time. Now these COVID-19 vaccines that are being developed now, obviously not 10 years. In fact, probably, well, less than a year. And so for some people, that's a concern. Now, those who are producing the vaccines are saying, well, it really shouldn't be a concern because they've apparently followed all of the safety protocols and everything else. They're saying that a lot of the time that it takes, it's government red tape and all this other stuff, that basically the government said, it just, cut the red tape and go Operation Warp Speed. Go and produce these things. But there are those who are asking those questions about, were corners cut? And we don't know. I don't know. Let's put it that way. I can't answer that question. But that is a concern that people have. And another concern, just kind of along with that, is that the Pfizer and the Moderna that are out there, they're mRNA vaccines, messenger RNA vaccines. And that's a brand new technology, right? So this is the first time that a virus has ever been developed using that, using that process. And so people are asking questions about that as well too. But you're going to get responses on both sides. Some are going to say they're safe. Some are going to say, well, we don't know. But these are all factors that we need to take into consideration when choosing whether or not to accept a vaccine.
Has the mRNA
I said loud so we can hear.
Has the mRNA been studied, prior to them putting it into a vaccine, for the purpose of a vaccine?
The question is, has the mRNA process been studied prior to being used for these vaccines?
Something that's been maybe looked at for the past so many years, anticipating that we could use it in a vaccine, and now all of a sudden, the opportunity, because you don't need a vaccine until you have a disease.
I don't know the answer to that question, so I can't.
Yeah.
I will speculate that because it came about so quickly, or at least the process of the vaccine came up very quickly. I'm sure people have been studying it for a while, but as far as exactly how much in the past, I do not know. I don't know. Anybody else?
Will we need a vaccine for every new COVID type?
The question is, are we going to need a vaccine for every new COVID type? The answer is, I don't know. There's a lot of I don't knows. That's another question. We don't know. Another one of the concerns that has been brought up is that there have been other coronaviruses, like the SARS from about 10 years ago, and then there was another one. I'm just the MERS. Yes, the MERS from a while ago too, and they tried to developed vaccines for those viruses and they weren't successful. So this, as I understand it, these are the first vaccines that have been developed for a coronavirus type of infection. Now, if another one comes along, are we going to have to go through the whole process again? I don't know. I don't know. But we'll see. Joe, we got a question from the... Oh,
Yeah.
we got Joe, and then we'll come to here.
Okay. Are you proposing a deontologic or utilitarianism approach?
We are certainly not a utilitarian. Ends justify the means. No, not at all. The approach we are taking is one of prudential conscience, prudential formation of conscience. That's where we're coming from. Sir.
Okay, regarding the SARS and MERS, that was I think 2003.
Yeah.
So pretty much I think what happened was.
Can you take your mask down? It'd be easier to, yeah, thank you.
So what happened was within like a year time, nobody got it. So it just disappeared. Same thing happens for MERS. So there was even like a couple of years after that, they were trying to make vaccines, but if nobody in the world get the disease, why you need a vaccine? So I guess some people's thoughts is if this coronavirus may go away on its own, like the other ones, like the other coronaviruses. Why do we do? Was the vaccine even needed?
Right.
Given enough time, it may just go away from this world. That's one possibility. So.
Yeah. So for those who may not have heard, what was stated here is that the SARS and the MERS vaccines, they came and they had their day, so to speak, and then they petered out and they left. And so the question is, are we going to have the same thing with COVID? And there are some people who say that. They're saying, that actually that's what they think is going to happen. And it may be. And so the question is, well, why are we spending all this money and producing a vaccine? I think the answer to that is, if we accept the numbers that we're hearing, 3,000 people a day are dying from this vaccine, and an X number of million people around the world have died as a result of this vaccine. So, if we can curb that off and do the best we can to do that, that's why we would. I guess the question would be if we weren't trying to do a vaccine, how many people would die of COVID? And I don't, we don't know what the answer is. So, we do know that people are dying. And I think that's probably the reason why.
Just on that follow-up.
Yep.
Like in terms of the date, because there was like news back, I think from CDC, because when in the hospitals, when they determine death, even if you die, like if you go from chest pain, you die from heart attack, but they test everybody, if the COVID test is positive, you label that dying.
Right. They label it as dying of COVID.
From
Right.
COVID. And I think at one point they were saying like only 6% of all the days that we were counting were actually died purely from COVID.
Right.
They had so many other serious things that may have been the main cause of the death.
Right.
So the death rate itself, I guess if you analyze it, it may not be as high as it's counted.
Right. So the comment, again, for those who are watching on TV, is that there's some disagreement, I guess, maybe some discrepancy about COVID-19 death rates, because people are dying of all sorts of different underlying conditions. It could be heart conditions, cancer, whatever the case may be. But if they're COVID-19 positive, at least initially, their deaths are listed as COVID-19 deaths. And again, that's, numbers have been shifted, and when all of this plays out, we'll probably have a better take on this. I'll be the devil's advocate to this. I recognize what you're saying, and there's a lot of stuff that needs to be figured out and will be over time. But I guess I would just respond to that by saying, yes, people they are dying of other underlying conditions and everything else. But I guess the question becomes: if they contract COVID, is that a contributing factor? Does contracting that virus, I don't know what's the word I'm looking for, Does it accelerate? Does it, in other words, does contracting the virus weaken them, weaken their immune system, weaken them in other ways so that their underlying condition can have, the greater consequences of their underlying condition? And I don't know the answer to that, but it's, it's kind of where a lot of this is we're figuring it out as we go, and that's kind of what's going on. See, the gentleman over here.
Yeah, it's fascinating. I'm not a scientist.
Welcome to the club.
But it's fascinating to me that the way these cell lines continue to duplicate and that, they're using these, from abortions that occurred back in the 60s and 70s. Is there ever a time where they run out? The open question there is, for people that are pro-abortion might say, well, this is important for science and we have to keep going with this. So, so it's like being a little pregnant, you certainly maybe as a Catholic, and the takeaway is to be patient and wait for the one where you get all the green, across the board and feel good about it, but that may be a while, and I'm concerned with this new administration that there may be a pressure to, everyone's got to get on the bus type of thing. So I know I'm spouting off a little bit, but the other question is really more about just the abortion piece.
Yeah. Now you bring up, what's your name?
Joe.
Joe. Great name.
Keep it simple.
Joe brings up an excellent point, and I'm glad that you did, because there's all sorts of things going on. What you said, and for those who are at home, kind of a two-part comment, really, or a question and a comment. So, we've talked about these abortion-derived cell lines that were created, quote unquote, back in the 60s and 70s, and do they ever kind of run out? And the answer to that question is, as I understand it, kind of a yes and no. So the HEK 293 cells are going strong, right? And in fact, HEK 293 it's the gold standard in terms of biological research. This is what everybody is using. And in fact, most scientists, most researchers, they don't have any idea where the line came from. They don't care where the line came from, right? But they really have no idea. It's been around so long, it's the gold standard that's what
Is there
it's
a
working.
marker that basically says you definitely know that it came back from there? What if, there was a recent abortion or something and they said, hey, let's
Well, okay, so now you're getting into your comment. Is the fact that we're using these abortion-derived cell lines, is that incentive for more abortions to derive more of these cell lines? That is exactly what many scientists are saying. They're saying exactly that. They're saying, look, right, we need to advance science, right? Look at the success we've had with pediatric vaccines and other vaccines. The list is here. Look at the success we've had with these. Look at the success we've had with COVID-19 vaccines using these abortion-derived cell lines. We need more of them. And they have pushed. This is where, going back to 2001, before 9/11 happened, the big controversial issue, which many of us don't know about, was scientists were doing exactly that. They were pressuring the Bush administration, Bush 2, to open up federal funding for more of this type of research. And George Bush said essentially no. When Barack Obama was campaigning for president, he said, taxpayer dollars, absolutely. And he did open it up, not everything that the researchers wanted, but he basically opened the door. Donald Trump closed it again. By the way, Donald Trump has a lot of warts, a lot of challenges with him. But in terms of being pro-life, in terms of his support of religious liberty and our work at the NCBC, fantastic. Absolutely fantastic. Other problems, absolutely, but absolutely fantastic. But with the Biden administration, I think we're going to go back to that. Scientists are saying, they're making this claim that, look at the success we've had. We need more of these cell lines. We want more of them. And my guess is the Biden administration is going to green light our tax dollars to produce more of these cell lines. That'd be my guess. Yeah. Great point, and that's another side. Now, hopefully, and actually you jarred something else. It's hard to do, to jar stuff up here.